because the difficulty for most women is usually when it comes to pushing out the baby's head. The woman might end up having painful sexual intercourse. Our aim is to ensure that both mother and baby is alive, healed and hearty. Hi beautiful people, welcome back to my YouTube channel. If you're stopping for the first time, you're welcome. My name is Isholona, and on this channel we create content on faith, on health, on nursing as well as makeup. So if these are the kind of content you're looking out for, please do not hesitate to like, share as well as subscribe to the channel. Now in today's video we're going to be looking at episiotomy. I don't know if it's a term you're familiar with. You might have heard about it, especially if you're pregnant or definitely in the medical field. Now, what is episiotomy? Episiotomy is an incision made into the perineum of a woman during labor to help facilitate the labor and delivery process. And by perineum, I mean the region that exists between the vagina and the anus. Now, what I simply mean is that during labor, the midwife might make a cut in the perineum, which I've already explained, so as to help hasten or fasten delivery, because sometimes the vagina doesn't stretch enough for the baby's head to proceed out during delivery. Now, what are the types of episiotomy? There are actually several types of episiotomy, but the one that is majorly used is the mediolateral episiotomy, where the midwife makes a cut from the vagina or an incision from the vagina downwards and then moves laterally. Now, the essence of doing this is to ensure that if anything happens peradventure, it does not extend to the anus. That is, the tear or the cut made does not extend to the anus. That is why this is more common and preferable. Now, what is the process like? Now, ideally this process is carried out only on the delivery bed, okay, when the woman is already having progressive labor, and for whatever reason that might have come up, the baby is finding it difficult to proceed out, of the vagina. Now, once the woman has given her consent for this procedure to be carried out, the midwife can now proceed to administer a local anesthesia to the skin and the muscles in the perineal area so as to numb the region ahead of the pain that the pregnant woman is going to feel. Now, once the numbing effect of the anesthesia has been felt, the midwife can obviously carry out the episiotomy, make the best incision for that situation, and then the baby's head can be brought out and the baby being born, as well as the placenta. After this, there's going to be what we call the episiotomy repair, where that region that was cut or incised is being stitched back up, or as you would call it, sewn back up. Now you might ask, why would a midwife want to cut someone up when the person is already experiencing labor pains? One of the reasons could be as a result of large baby. Now, when it comes to the baby, the part of the body that is larger or the largest is usually the head, okay, and in birthing the head, it might be difficult for some women, especially if that's the first baby, okay. So the midwife might try to make the incision to help facilitate the delivery process. Another could be fetal distress. In fetal distress, this is when the baby is already going low on oxygen, especially when a woman has pushed and labored for a very long period of time. During the process of labor and delivery, ideally the midwife is observing not just the woman but also the baby. So we are checking for the baby's heart rate as well as the woman's baby heart rate. So if we notice any form of irregularity, or for example the heart rate is slowing down, the midwife doesn't have the luxury of time to wait until the woman is pushes. Our aim is to ensure that both mother and baby is alive, healed and hearty. So in situations like that, episiotomy might be carried out. And finally, not limited to this, prolonged labor. Like I've said, when a woman has labored for a long period of time, the women who labor for 2 days, the women who labor for 2 days, for 4 hours, a whole day and all. So in situations like that, especially when the woman is already tired, and we could also tell that the baby is tired, like I said, fetal distress, episiotomy might just be the way out, okay, because the difficulty for most women is usually when it comes to pushing out the baby's head, okay. Once the head is out, the rest part of the body is easy, okay, but when it comes to the head, for most women, especially if their first pregnancy, they might find it difficult pushing the baby's head out. So hence episiotomy can be done. Now, what are the advantages of episiotomy? The truth is, episiotomy has advantages. Okay, one of the advantages is that it reduces the likelihood of third degree tear. If a clean cut is not being made by the midwife, there's increased risk of the woman tearing herself when the baby's head is about to be born. Okay, and you cannot tell the extent of the tear. Hence, the advantage of doing an episiotomy that can easily be done and stitched well. Also, it reduces the risk of fecal as well as urinary incontinence. Also, obviously, episiotomy facilitates labor. I mean, it hastens, the labor process. The time you have spent doing this, doing that, spending hours, in the labor room, trying to birth your baby. With episiotomy, it makes it faster. Also, it might be easier to repair episiotomy than it might be easier to repair a perineal tear, especially when it gets to third degree tear and so on. And finally, it reduces the likelihood of fetal complications. Like I talked about fetal distress, the more time the baby spends in the womb, the higher chances of the baby having complications when being born. But with episiotomy, you're able to eliminate all that extra time. That being said, episiotomy is not without its disadvantages. I said there are several types of episiotomy, and depending on the type of episiotomy, there's also likelihood of it getting to the anus and causing fecal incontinence, like I've explained, depending on the type of incision that is being made. Now, what are the complications of episiotomy? Obviously, there's going to be bleeding. There's also risk of having incontinence, both of feces and urine. Like I've explained, there could be leaking of urine, leaking of feces. There could also be likelihood of infection, especially when a sterile procedure is not being carried out, as well as dyspareunia, which is painful sexual intercourse, after the stitching of the episiotomy or episiotomy repair is being done. Later on, the woman might end up having painful sexual intercourse. Now, what are the management of episiotomy? I said that once the cut is made after the delivery of the baby and the placenta, then the cut is being repaired, that is sewed back. So what are the management of this? Now, it's important to note first off that every woman is different. Okay, now the healing time, just like every surgical intervention for individuals are different, the same thing with episiotomy, the healing time could also differ. Now, since a cut was being made in that region and stitched back, you want to ensure that that region is kept clean, free from any form of infections at all times. Okay, so ensure that that region is clean. When you finish having your bath, that region is dried down. Don't doubt, don't use anything that's going to irritate the skin in that area. Wear breathable underwear. Also ensure that the pads you're using postpartum, you change them very frequently to avoid introducing infection to that region. You also from time to time ensure that you check the sutures to know how far you have gone in the healing process. You are the only one that can know whether this thing is healing or is getting worse, or there's a breakdown in the site. So that also your medical team is going to advise you to abstain from any form of sexual intercourse for a period of time. Okay, pain reliefs as well as antibiotics treatment will be given to you during this period. It's normal, just take them and adhere to them. Also, laxative could be given during this period of time, just to prevent the issue of constipation. Apart from that, you could apply ice compress to that region to help reduce the swelling. Steeze baths can also be done to help reduce the level of discomfort that you may be experiencing. I've explained all this in a postpartum video already. Please go and check it out. And with that, we've come to the end of this video. I hope you're able to learn from it. Okay, if you have any questions, please let me know in the comment section down below. I really do love creating content, especially when it comes to the midwifery aspect of my profession, because you women are my priority. Okay, if you have any questions, please let me know in the comment section down below. And until I see you next time, bye lovelies, and God bless you.